So glad that you're here and joining us today for our fourth installment of Coping as a Community with COVID-19. But we emphasize the need to be in community at this time. It's wonderful to see everyone. So in our former sessions, we've been able to do a little bit of a mindfulness practice, and we'll start that just through a breathing practice here soon. But just wanted to take a few minutes to do a little recap of where we're at today with our series. Dr. Henry Tan, through the Office of Health, Equity, Diversity, and Inclusion, has institutionalized our sessions to be able to be available to our community and being able to go through this crisis together. We've been able to talk about a variety of topics around how the pandemic is affecting us in our lives and how we're going to thrive through this together. And today's guest speaker is also going to assist us in the thriving component. So at this time, as people are joining us, I'd like you to just get centered and just get into your seats. And we're going to do a few cleansing breaths together. I know for me, I was rushing to get here on time. And a lot of times we just need to pause and reconnect with our bodies and ourselves to produce the peace and presence that we want to get into. And so just taking a deep breath through your nose together at this time, filling up your lungs with some great oxygen and releasing that. And as you release, just let your body fall into the breath. We're going to take 2 more breaths together through the nose, coming in, getting the oxygen in, and the release. Just let it go. We have quite a few people still joining us. And we're going to take 1 more cleansing breath, a nice deep breath through your nose. Hold it for a second and let your body fall as you release. Getting that oxygen into our bodies is the way we're going to take care of ourselves in the series of compassion and empathy and care for ourselves and others. So at this point, I'm going to turn over our presentation to our guest speaker, Dr. Andres Sciolla. So Dr. Sciolla, can you tell us a little bit about yourself so that we can begin this session?
Thank you, Mercedes, and thank you to the Office of Health, Equity, Inclusion, and Diversity for inviting me. Excuse me, and thank you everyone for being here present today and joining us in this conversation between Mercedes and I about stress, trauma, and resilience. I can tell you a little bit about myself. I know a thing or two about resilience because of my background. I'm an immigrant to this country, and I'm an openly gay psychiatrist who went through training in Chile that was quite homophobic, and I had to hide. And I really didn't understand how much stress I was put on myself until I came to this country in 1991 to work at UC San Diego initially. And I serendipity had it that I would start working in a research program that was gay friendly. And that was such a revelation for me to be able to be out in a working environment and the lift of the stress. That was magnificent, actually. And I was fortunate enough to be immigrated, do the paperwork through UCSD. They were the sponsor. And at that time, I joined the research center in HIV. So for many years, I worked with a whole cohort of HIV positive or at-risk men and women of all walks of life, if you will. And I was very active in the community to engage the community, in especially communities of color, in the research cohort. So all that experience has been extraordinarily helpful for me to understand my own resilience, my own hot spots, and my own blind spots. And then when I graduated from my residency training program at UC San Diego, I started working with a very underserved community near the border in San Isidro, California. I worked there for 12 years and until I moved here in 2012 and to another community clinic with very underserved, very diverse population, many immigrants to very diverse, again, with many aspects of stress in all its manifestations. So my area of expertise professionally has been to help adult survivors of adverse childhood experiences and trauma. So that's where I come from. And I hope to be able to share some of the lessons I learned over the course of this conversation. So thank you again for having me.
Thank you, Dr. Sciolla. And that's where we had met, is in both of our work with adverse childhood experiences and trauma. And so we're wanting to start this session to get everyone some more information on stress. We have quite a few people from our external communities, internal communities, our health system here, our main campus. And so supervisors and managers and leaders and every staff member are going through elevated times of stress, and this unpredictable crisis brings a lot of unpredictability. So as we're going through this stress together, Dr. Sciolla, I'd like you to be able to talk about your work and your research on chronic stress. Can you discuss the effects of chronic stress on our physiology and our bodies? And then what are some of the normal reactions that can occur when people are undergoing stress?
Sure. So I'm taking just a quick note to remind myself and you will also remind me, Mercedes, if I forget something of that question. It's a big introduction. I think the first thing that I would like to share with you all is that one of the tools that I like to share with my patients and my trainees and my colleagues is psychoeducation, the power of education. The more I learn about science of stress and resilience, and I'm able to explain that to everyone, I notice the positive effect of this. And let me digress a little bit to give you an example. For many years now in psychiatry, we have created some lingos and some expressions to refer to mental illness that the general public has adopted and embraced some of them, like a biochemical imbalance, for example. The idea of a chemical imbalance is a simplification of something quite complex, but it's very helpful for some of us who can identify that there's a problem that is hard to put a name on that I have with a mental illness, but if I put it under the label of a chemical imbalance, it's no longer me as a person. It's something broken or bad or dysfunctional out there, if you will, but it doesn't completely engulf me, doesn't completely define me. And that's a very powerful initial step in healing and recovery. And I first discovered that when I started seeing these patients near the border, as I mentioned, in San Isidro, and hundreds of them. I started seeing many of them with history of childhood trauma. And I knew enough at that time about childhood trauma that I started to convey to them basic concepts of trauma and the brain and behavior. And it was so illuminating and helpful for them to realize, my goodness, this is what I'm feeling, is what I've come to realize is a problem, and I maybe hated myself for this or felt terrible and created all this stigma around. It turns out, Dr. Sciolla is telling me, that it's a completely normal reaction to abnormal circumstances.
Right.
Hallelujah.
Yes.
So there's a shift when we understand that something happens, especially things having to do with the mind and the relationship between mind and body, that can be quite puzzling, and we cannot help but taking them personally. But it's alleviating when we know that this is part of our physiology. And so education is a key piece. So if I can elaborate a little bit more about the education, to talk about stress, I think one key element to understand the science of stress is to borrow from another discipline called evolutionary psychology to look at stress in humans and in mammals from a perspective of evolution. And it turns out we can dialogue more and go to the details, but the bottom line is that many of the behaviors that torment us and make us suffer in our modern world are like fossils of evolution. They're remnants of behaviors that evolved in a different environment, and in that environment they were life-saving. They were the key to the survival of our species. Therefore, those of us, our ancestors who lived through those environments, were screened, if you will, by evolution to survive and pass those genes and those behaviors onto the next generation. And we are the heirs of those behaviors. And those behaviors are, as I said, life-saving, but they can become problematic in our society.
Okay, thank you for that. Then Dr. Sciolla, what I hear you saying about stress, the evolution component of it, and what's currently being researched and some of the evidence is going through somewhat of a cognitive reframe for us that is going to be able to benefit us with focusing on what stress produces in our minds, perhaps with negative thoughts, and how it affects our bodies.
Yes, and we have some slides to share a little bit later with the audience, in which we will revisit that in more detail. But I want to deepen a little bit the understanding about this and give you some examples with how something that in our evolutionary past, in the dawn of our Homo sapiens, hundreds of thousands of years ago, something was adaptive and is not so much at times with us now. So we are, as you all know, a very social species, and our brains are exquisitely attuned to verbal and nonverbal cues of belonging. We are very helpless by ourselves. We cannot survive in the original environment, if you will, in the African savanna, if you will, in which our species first appear. Only small groups of humans could live really and travel. And so these small bands needed to be very cohesive and very, we are heirs of that, and social rejection and exclusion is extraordinarily painful because we don't want to do that. We evolved to detect any signs of exclusion and that propel us to do whatever it takes to become part of the group again. We wither physiologically, psychologically, in all ways, and we die eventually if we stay out of our clan, our tribe, our family. So that was a very important adaptation of our brain. But then we fast forward hundreds and thousands of years now, and we have, where's mine? These devices and others and social media that bombard us constantly with images of ourselves and other people, and our archaic, ancient survival mechanism of, do I fit in? Comparing ourselves to others is a source for stress. And there's research that shows now that there's a correlation between the use of social media and the levels of stress and anxiety. So that's an example of how something that was life-saving at some point can now become more stressful, can add to our level of stress. And we'll talk more about chronic stress a little bit later, but I wanted to give a more specific example of how understanding where we come in our evolutionary past can help us normalize our responses and feel a little bit better about our brains who are doing just what they're designed to be doing, which is safety first, our own safety.
Right. So can we move to the PowerPoints, Dr. Sciolla? Because I believe that this would be a great time to be able to see a visual of what you're describing. So I'll put those right up. Okay.
Thank you. So this first slide we have here is a schema, a very skeleton of something highly complex, but to represent how the stress response system responds to acute stress. And this system is designed to help us survive acute stress and threat. So I imagine this is exactly what you're seeing. So in the far left, you see this threat that triggers our stress response. And the stress response, we broke it down for clarity's sake into two components, body and mind, but they're really highly interconnected. In the body, the most common behavioral responses most of us are familiar with are the fight, flight, and freeze. Fight is, of course, think of a wild animal that we have to, or another person that is attacking us and we have to fight. Flight is to run away from the threat. And freeze is a less known but equally prevalent response of all kinds of animals, including the humans, who faint, if you will, who drop dead, play dead at a point of panic. And this is uncontrollable. It's something automatic that gets triggered, and there's nothing that we can do, or very little for us to do. And just to illustrate the power of freeze, many victims of sexual assault end up blaming themselves for not fighting back. And just educating them about this can be enormous relief, so they can realize that it's not them. There's not cowardice or weakness or anything like that. It's just a survival mechanism that got triggered, and there's nothing that we can do. So these behavioral responses are associated with increased production of all these chemicals that accompany stress. I'm just mentioning two of them that are most studied, catecholamines such as norepinephrine or adrenaline, and cortisol. Now, the next step here in the slide is the activation of the immune system. It's something that we don't talk so much about, but the increased production of catecholamines and cortisol really goes everywhere in the body and changes everything, prepares not only muscles or heart rate or blood pressure for the fight, flight, or freeze response, but also activates the immune system. And that leads to an optimal immunity to meet the challenge of the threat. In this case, we're talking about COVID, and one type of immunity for acute infections. We have that type of immunity, and that works fine, and it's no problem with that. And we see the threat disappear. In the mind, if you will, pathway, we have the first adaptation in fractions of a second is a tunnel vision. The meaning that the activation of the emotional brain, and we may talk a little bit more about emotional brain later, produces instantaneously a tunnel vision in which we focus and sustain our attention in the threat. We don't get distracted because this is our survival. If a tiger is attacking us, we don't want to be distracted with a beautiful moon up above the sky. We just stay focused until the threat disappears. So this tunnel vision leads up to an optimal behavioral adaptation that could be fight, flight, or freeze. So let's move to the next slide. And my understanding is that the audience will be posting questions on the chat feature, so feel free to, we can go over any of these elements, any element at all, slides or not slides, at the end of the presentation. Now, this system that works so well in acute stress, in the presence of chronic stress and trauma, it can break down. So what we have here in the upper part of the slide, the body, we end up with a dysregulation of the hypothalamic pituitary adrenal axis, which is one of the main pathways that communicates the brain and the body. And there are others, and I just don't want to go into too many details about this, but this leads an overproduction of these chemicals that are produced by white cells throughout the body, in the blood, but also in the brain and other parts, that produce these chemicals called cytokines that produce inflammation. And some of you, or many of you may know that more and more we understand that many medical illnesses, and when I say medical illness, I mean mental and physical, are, at least in some component of them, they are the product of inflammation, chronic inflammation. So it's not only fibromyalgia or chronic fatigue syndrome, but it's also diabetes, right. It's also obesity, it's also schizophrenia, it's also depression. So that is not going to eliminate the threat, but become a threat unto itself and add to the load of stress, chronic stress. Right. And if we looked at the pathway of the mind under stress response in chronic stress, we not only have the tunnel vision that comes with stress, with acute stress, but also the adoption of health risk behaviors. In other words, we discover that there are certain things that lower the level of stress, because stress is and fear is a very uncomfortable feelings that compel us to action, to do something. And when we don't know exactly where the threat is coming from, we just experience this discomfort, product of this flooding of the body with all these chemicals. And so we discover that, for example, weed might calm us down, or starchy food, or gambling, or something that happens that we adopt and start to do in attempt to regulate ourselves. But that leads to problems in the hippocampus, which is a structure in the brain that leads with memory consolidation and learning. And so we have memory and concentration problems. And these, what Mercedes was talking before, when she alluded to this, when she talked about cognitive reframing, which we'll talk about that in a bit, we have these cognitive distortions, these thinking errors that become automatic, unconscious, and we don't notice them. However, they lead to clinical anxiety, depression, and other mental health issues. And when I say mental health, I also mean things like substance abuse and so forth.
Mm-hmm. So of the risky behaviors, Dr. Sciolla, let's just take food right now. I'm going to be very transparent. And right now I'm craving a lot of comfort foods. Not so much, like sweets, but more so like rice and beans, mashed potatoes. So because I am being transparent, I have this level of anxiety just as we're changing and doing things differently and seeing what we can provide, and the uncertainty that my colleagues have also expressed to me. Is the stress also producing perhaps those cravings for that comfort food?
Yes, exactly. And thank you for sharing your personal experience, Mercedes. Mm-hmm. So there's research fundamentally has been done in rodents, in mice and rats, that show that they have, researchers have identified the chemical pathways, endocrinological, the hormones that are, and the chemicals involved in this circuit that leads, that connects the ingestion, the eating high caloric food, fatty food, and high sugary, starchy foods that can be broken down into glucose very quickly once they get into the bloodstream. And that triggers a series of other chemicals that end up feeding into the brain and shut down the stress response system.
Okay.
In other words, comfort food is an excellent antidepressant and anti-anxiety. So, and many of you may have discovered that. And the body, our bodies, remember that we're made of three brains, really. One, what we call the reptilian brain. One is the mammalian or emotional brain, and then the rational brain. The reptilian brain takes care of our breathing, our basic function, metabolism, and hunger, and breathing, and blood pressure regulation. But then we have the emotional brain. And the emotional and the reptilian brain are quite independent. We can regulate them to an extent, but they can be very compelling. And all of us are familiar with feelings that come from an emotional brain, such as love and falling in love or being lusty. They are hard to control, and we do foolish things sometimes because we are guided by this emotional brain. And so controlling high caloric comfort food is not just it is willpower, but it's not small potatoes, pardoning the pun, because it's really challenging. It's something very powerful that once the body discovers that, it's very easy to get into a habit.
Mm-hmm, mm-hmm. And so, Dr. Sciolla, you and I had just a small conversation about comfort food, but you had also mentioned that when we engage in comfort foods, that it actually reduces the cortisol that is elevating the stress for a period of time. Is that correct?
Yes. So there's a feedback loop. And so I was saying that these kind of food will shut down the stress response system, meaning it goes down adrenaline, goes down cortisol, and other problems, other chemical signals.
Okay.
Now, it's also true that since it's hard for us to stop doing that, and we have so much chronic stress in our lives these days, we can gain weight, of course, with this high caloric food. And then what happens, that obesity produces inflammation as well. So it's complicated and tricky. And then one last element that we can add to this is that we believe that, going back to evolution, now not of the brain, but of metabolism, we as a species evolved at some point to be binge eaters, to be very good at stuffing ourselves with food, because we evolved in an environment in which we didn't have Doritos everywhere, so to speak, or fruit or whatever. We had to rely on small supplies of food that would be available intermittently to us. And so we had to eat a lot and store a lot of fat as much as possible, because we never knew how long will be until the next meal.
Mm-hmm. And so that reduction of cortisol, comfort food could actually be an antidepressant in that moment.
Yes.
Right?
Antidepressants, anti-anxiety, and all those good things. Comfort. It gives us comfort.
Well, it makes sense. It does make sense. So from here, Dr. Sciolla, I see that you have also the mind goes into tunnel vision.
Yeah,
and
why don't we take a look at that slide that wants to represent something very important in this education, if you will, that we're conveying to all of you. The idea that under stress, it's normal and physiologic for our minds to be extraordinarily biased and leave out a lot of things that are real, that are out there, but they're not relevant to that mood. So when we are sad or mad or afraid, we only see some elements that are in reality that are congruent with that feeling, not other things. So this solution that we have becomes a problem, because once it becomes a habit of mind, some of us may be prone to keep thinking in these patterns, making these cognitive errors, and they're very well characterized. Many of these biases are very prevalent, particularly when we are under stress, and those of us who have tendency to have problems with depression or anxiety. So to give you just one example, we, under the effect of the emotional brain being afraid, we predict the future. We have the ability to predict the future. Well, we think that we can predict the future, and we do that all the time, 24/7, all the time, which is, of course, a life-saving property of our brain. Predicting the future or imagining the future, simulating the future, allow us to plan and to problem solve ahead of time. So it's a blessing, it's a wonderful thing, but it also can run out of control and make us imagine terrible scenarios that may never come to fruition, because we have this human brain that is very good at producing these scenarios. So this is one example. Another example is that under this bias, this tunnel vision, we discount unconsciously the evidence to the contrary. So we think that this is true because we see it, because we feel it, and then we don't think about any other things that may challenge our perception, our ideas. So these are very common and can be, in a way, these tunnel visions can be collective tunnel visions, because if we're in a community, for example, in a WhatsApp group, that we all think alike and we feel into each other, we may end up with a very skewed view of our reality. And this is a vicious cycle, because the more you focus on a problem, the more emotional brain stress response system gets triggered.
Mm-hmm. And so with that response, Dr. Sciolla, in our discussions before, we also talked that these behaviors, this way of our brains functioning, can also produce strong emotions of shame when we engage. And so can you talk a little bit about those strong emotions of shame and guilt?
Sure, that's a very good point. So each emotion, each of our feelings are linked to certain behaviors. They make us do something. And shame is a very powerful, let me begin with guilt first, because I think it's perhaps more universal. So guilt, once we feel guilt, the purpose of guilt is to help us repair the harm that we've done. It's a recognition that we have been cruel or bad or wrong, we have broken a value that we have, or we have harmed a loved one, or done something that we don't think is right. So once we repair that wrong, the rational response should be move on. Guess what? Unfortunately, feelings have a dynamic of their own, and they can be extraordinarily persistent. And they use quotation marks, this tunnel vision to feed onto itself and perpetuate themselves. So for example, I'm a victim of a sexual assault, and my tunnel vision makes me instead of a victim, I experience myself of having blame. I was responsible. I don't know, I was wearing a provocative dress, whatever my mind comes up with, and I focus on that. And so the guilt makes me forget other things. And then I can carry that guilt for years, decades. And guess what? Guilt triggers feelings of depression and hopelessness, and that becomes a vicious cycle, and it can be a very toxic emotion, in other words. And when I am able to expand that tunnel vision, all of a sudden, by myself or the help of a therapy or whatever, I realize, my goodness, this is not my fault. I was assaulted, or someone took my wallet, or instead of blaming myself and feeling guilt, I realized that this is much bigger. There was something that I couldn't control, or maybe I did the right thing because otherwise I would have been guilt, for example. So then you can challenge that toxicity, if you will. And shame is another of those feelings that are highly toxic to the self and can be very chronic, and they're not helpful. Because once we address that feeling, we should put our emotional brain to the side and tell gently and with as much self-compassion as we can and say, not now, this is not the moment, I'm going to move on, and I'm going to forgive myself, I'm going to be compassionate with myself and do what I can. I'm going to focus on what I can control now.
Thank you, Dr. Sciolla. We have opened up the chat so that we can take questions as we're going through the webinar, and that we'll try to also address during the webinar. But we do have one question, Dr. Sciolla. Someone's asking, can we discuss coping mechanisms to deal with current COVID stress when the community is in a family setting? We've talked about the stress now living at home, working from home with all family members and what have you in our former sessions. And so this tends to be an ongoing question for us. Should we take time to address that now, or could we address that later in the webinar?
Can we, there might be other questions similar to that, so I may want to complete these slides.
Okay.
And go back to that towards the end so we can talk about those concrete steps.
Perfect. So we'll address those questions then. Thank you. So I'll move on to the next slide. And I just want to make sure that everybody is seeing the slides when I change them. So I'm going to reshare every time just to ensure some folks weren't able to see them, and just bringing them up again. So currently, Dr. Sciolla, then moving into our area of resilience. Can we define resilience and talk about your research and resilience and the work that you do?
So resilience is a complicated concept. We use it quite a bit, and it's become very popular, and seems to make a lot of intuitive sense to many of us. But the more we looked at it, we realized that it's more complicated. There's more details than meet the eye. So initially in research, when this emerged 20 or 30 years ago, people thought of resilience as resilient people, hardiness in people, people who could bounce back from adversity. Something that we can have, we are as individuals. But the more we do research into this, we realize that it depends so much on the context, and also depends on the stage of life. So resilience is something much more dynamic than we initially thought, and it's certainly not only a personality trait, if you will. My resilience as an individual may vary from moment to moment, and depending on the stressor. There are stressors for which I may not be very resilient, and others much more so. That's one clarification that I would want to make. The other thing that we can say regarding resilience is that it depends on the context, meaning, let me give an example. Unfortunately, social inequities in our society give people in more disadvantaged a double whammy, give them those inequities give them an unfair load of stressors, but also less resources to buffer those stressors. So context is very important. And then the other component that I would like to add is the timeline, the development. So when we are born, we're absolutely zero resilient. We're not resilient. So it is our family, our adults, our parents, our caregivers who gives us that resilience. They manage our resilience. They give us the resources that we need. And it's very slowly through development that we start to internalize and learn what others, the adults, are doing for us to become resilient. So if my family, my parent, my caregiver is under stress and is unemployed, cannot pay bills, their ability to infuse me with resilience and buffer the stress will be bigger. In other words, to be in a very concrete example in this moment, there might be many of you who are in a situation like this, or at least people that you know, under the threat of losing income and having this less resources to tend to children and reassure them, for example. And children are perceiving what's happening, and so this can be a very difficult situation to manage.
Okay, thank you. So then,
sorry, Mercedes.
That's okay.
You asked a third question there,
Yes.
which is the resilience in research, and talk a little bit about what I'm doing with this. And really, it's a we. I'm part of a team of educators in the School of Nursing School, Medical School, and Veterinary Medicine School. And we are studying what are the drivers of resilience in these students? How are they coping with the typical stressors of training? But we also right now, we want to start studying what is the impact of COVID on the stress level and the resilience of our students. So part of the things that I've shared with you regarding resilience, I've learned through this research. So we're looking at a very comprehensive look at resilience, not only about personal qualities. For example, we have a survey that assesses many characteristics. For example, mindfulness. All of us are in somewhere in a continuum of mindfulness as a personality trait. Some of us are more mindful naturally, if you will, or less mindful. So that's one component, but we're also looking at the learning environment. How are the students perceiving the learning environment and how that has an impact? Because being a sexual minority or an ethnic minority or a disadvantaged student in some way, being an institution whose learning environment is unsupportive, I have less resilient resources available to me. So the same person in a different institution could be more resilient because they would have the support of an institution. So that's why resilience is such a dynamic and complex construct or term.
Mm-hmm. And so we can definitely increase our resilience with the mindfulness, self-compassion, empathy. And so those would be strategies to reinforce resilience, correct?
Yes, at the individual level, yes. So that's why we're titling this Some Powerful Antidotes, because in the next slide, we'll see that others are already thinking about higher level of supporting individuals. And in the next slide is taken from a recent paper in which researchers in psychoneuroimmunology, meaning the science that tries to connect the brain and behavior and immune system, are thinking in global terms with interventions, not only at the individual level, such as diet and gut health, but also about mindfulness and cognitive behavioral therapy. In addition to that, they're also thinking that this science should influence care policies with, and I'm just picking one example, physician training. So where we're doing in medical school and with practicing physicians or healthcare professionals. And then at even wider level, we're thinking about policies. For example, UBI stands for Universal Basic Income, which is another way of saying, let's give people some cushion, some basic cushion, the ability to buffer stress. And the next slide is another look at the same idea, that is not only the individual who has to do something about stress, but also we have this taken from a paper that was published in JAMA a couple of days ago. And it's a busy slide, I know, and this will be made available to you all so you can read it at leisure. But this is based on focus groups with healthcare providers, and they identified the expectations, the needs from healthcare providers in regards to institution and leadership. So these are the things. I'm going to read just the column on the far left, the request. And these are the needs that they're voicing. Hear me, protect me, prepare me, support me, care for me. So these are broken down and specified in the principal desire, the concerns, and the key components of response. So it's not only mindfulness that is going to help us through this pandemic, but it's also very concrete things that we should be transparent and have a dialogue with our leaders about what we need. And they should also be transparent and forthright in terms of what they can and cannot do. So that's the last slide. And I want to just make sure that we leave enough time for questions from the audience too.
Yes, and so then we can ask for questions, but I really love this slide because it's talking about that whole component of care. So for ourselves, for the community, and for the organizations that we work in. So thank you for that slide, Dr. Sciolla. We can take questions in the chat if those who are guided to do so, but I'm going to return to the formal question, Dr. Sciolla, about COVID-19 stress, how to manage that when our communities are our own families. So many of us are working at home, living at home, taking care of children, which is quite stressful, all of those components of change in the same space. And so for that, thinking about what would be some other ways to take care of ourselves in that type of environment.
I probably will sound repetitive because to me, all the specific tools go back to some of the general principles that we have already discussed. And I will go over those, but let me add a few pieces of information that I think are important in regards to this question, families and children. Stress in children is manifested in different ways. And it wasn't in the first slides. We talked about the fight, flight response and freeze, but children have their own unique ways of responding and expressing stress. And I'm going to give you an example, taken from a webinar led by Alicia Lieberman from UCSF. She's a psychologist and deals with stress and trauma. And she was recounting an anecdote with a patient of hers who was very distraught because she was sheltering at home with 5-year-old, let's call him Kevin. And Kevin had to take into this game in which he would say, I'm dying, I'm dead with COVID or with a virus, something like that. And the mother was a survivor of trauma, and her reaction was very unhelpful because she could not be available to act with compassion towards Kevin. And so she was yelling at him, and because it drove her crazy. That was very upsetting to her. What for Kevin was a game, for her was terrible. And so went to the doctor, the psychologist, and Alicia asked the patient, what do you think Kevin is trying to communicate with you? And then all of a sudden, the patient herself was able to verbalize and said, maybe he's afraid he's going to die. And so Alicia, the therapist, said, why don't you ask him, see what happens? Lo and behold, happy ending. Little Kevin all of a sudden could have a language to communicate. And of course, the mother had a moment of breakthrough of empathy and could comfort him and reassure him, for example, saying, you know, children are very well protected from COVID. They normally don't get infected, and if they get infected, they don't die, something of that sort. And so the boy was responded much better. So having in mind, and I would tell people to read specifically, and we can share some of the resources offline then later. There are multiple websites with specific recommendations for parents with small children. And one of the elements is to recognize distress in children. Nail biting, bedwetting, a child that all of a sudden loses, that after having sphincter control regresses and is no longer managing that, or tummy aches, or not wanting to engage, temper tantrums. And so behaviors that are pretty clear, that are not part of the normal behavior of the child, should signal that there's stress and the need to address that stress with different ways to cope with that, to listen to the child.
Thank you, Dr. Sciolla. You know, so many of our parents are now, you know, homeschooling their children. We have students who are parents, and someone in the chat is saying, you know, specifically student parents that are homeschooling their children and trying to manage their own workload. And so this is going back to the former slide about organizations having some compassion also for our families that are, you know, in school, have children. Children are now being sent home to be homeschooled. Then there's work that plays into it. And at this point in time, for me, I want to say our children are our current boss right now in our homes. Their needs have to come first. And if we can dialogue with our leaders, as you were saying, to be able to have system level change that are supporting, you know, all of our staff members who are going through this new normal for now, really struck a chord with me on that former slide. We have another question.
And before I answer that, sorry, yes. Mercedes, it occurred to me another important element when we're talking about children and stress in children is in parenting generally, is the importance in conveying resilience to children, predictability. Children thrive in routines and habits. True. They don't do so well in, like all of us, in unpredictability and chaos. So the more we can do as parents and family members to reproduce or organize routines, the better. Children do better. Now, as all of you know, especially in certain ages, telling a child to do something might trigger a very strong behavior of disagreement, to say the least. But trust me, in the long term, there's nothing better for children than structure and limits, setting boundaries, and certain things that can be. And I'm saying this, I realize that in a confinement situation, it's under stress. It's harder to be patient, to be constant, and so there it comes when self-compassion comes in, when we forgive ourselves as parents to say, I'm doing the best I can under the circumstances.
Yes. Yes, having compassion for ourselves through all of these
Question, I'll be
circumstances.
honest, Mercedes, I don't mean to ignore that.
No, that's fine. So also there's fatigue from being online so much and using every platform to communicate in this, um, you know, imposed isolation that we're going through. So we're experiencing different levels of stress at different areas of our life that we hadn't, there's no way to really go to an elder who has gone through this before, or a mentor. How did you happen to deal with this type of pandemic? So we're all learning as we're going and trying to be as supportive of each other as possible. So we're going to learn through this. We're going to grow through this in community because we want to build community on this virtual platform, and just listen to everyone's needs as much as possible. Thank you so much. This has been a pleasure to be and have this time. Thank you all of our attendees for your taking the time out of your busy schedules to be with us, and we hope all good and health and wealth to you.